It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest-running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And we got my partner in all things, Tacey. Hello, Tacey.
Hello.
This is a show for people who had never listened to a medical show on the radio. If you got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. I can't mention contractually. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. And don't forget to check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. It's allergy season. You getting any orders over there, Dr. Scott?
Getting quite a few orders. It is.
Oh, good. Okay.
Yeah, 'tis the season.
And if you tell him you're a Weird Medicine listener, he'll throw in a couple of tchotchkes. We got some stupid crap. So, pins and
keychains
and coasters and stuff that you will never use.
Yeah,
Who cares?
They're cool, though.
Yeah, I give that stuff out at these live appearances, and I'm sure people look at and then just, rather than put it in their suitcase to go home, it just goes in the trash. But that's fine.
You never know.
Yeah, I don't know. On Google Maps, you can add photos, right? So there's this place, Frenchie's beach place down in Clearwater, and Tukey had put one of his stickers up on the like the stop sign pole, and so I put that in there as a picture for Frenchie's. So now anytime anybody looks there, they will see that. When they go to the Strath Allen, which is a very nice hotel in Rochester, they see a picture of Purple passed out at the Creep-Off Roast. So anyway, there you go.
There you go.
These two don't know what the hell I'm even
No
talking
clue.
about.
Nope.
All right.
But it sounds interesting.
Well, people, yeah.
Doesn't
I can
it?
tell. Okay, you know what?
Lord and lady, douchebag.
All right. Tacey, you've got some topics, don't you? And then
I
we're
sure
gonna
do.
and we're gonna do a lightning round again. Everybody really liked that. By
Oh,
the
they did?
way.
Cool.
Yeah, but I'm going to propose a slight modification to it.
Oh,
Okay.
you want more time?
No, well, yes and no. Tacey
Possibly.
has 3 minutes. We're got to give her a bell.
Okay.
That's one recommendation somebody had. But I think that we need to be able to ask for 1 more minute.
Okay.
If we need it, because it's important, we can ask for an extension of 1 minute.
Gotcha.
And that's it, though.
Gotcha.
Okay? All right.
I don't know if I agree with that. But
Well,
anyway.
doesn't matter.
The people have spoken. Dave.
It's Tacey's time of topics. A time for Tacey to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacey. By the way, Tacey, Darth Nugs in the Fluid family says, hi, Tacey.
Hello, Darth Nugs, and everyone else.
There you go.
I believe I've got several topics here, and we'll just go till you guys get sick of it.
Okay,
Cool.
Sounds good.
And the first one may be fake. It was sent to me by Scott, and I just I'm wondering if we're getting what do you call it when you get
Spammed.
doped?
Dope.
Gaslit.
Gaslighted.
Gaslighted. Yes.
So it's from Unilad. A family that only walk on all fours leaves scientists baffled as they shouldn't exist.
Well, no, they're just goofy.
Evolutionary psychologist Professor Nicholas Humphrey headed up the team who looked into the family. And the team were left shocked when they discovered that of 18 children born into the Ulas family, 6 of them had a unique disability, which resulted in them walking on all fours. Turkish scientists thought the family had devolved.
No, come on.
And found that conclusion was deeply insulting and scientifically irresponsible. Instead, he set about trying to find some other answer and the reversal of the evolution process localized within one family in Turkey. Neurological scans showed that the middle of the cerebellum appeared to be shrunk, but that provided no conclusive answers as people with smaller or even no cerebellums still can walk upright.
Of course.
Scientists appeared stumped as to what exactly was the cause for all this, as they could make observations, but the answer to the question of why this was happening eluded them.
Is this the Ulas family?
Yes.
Yes, it is.
Okay. Yeah. All right. I know a little bit about this. Go ahead.
When he returned to visit the family again, he found that their children could now walk upright after being given help from a physiotherapist and equipment. So this became viral, and it wasn't until years later that a team of Danish scientists finally found the answer as to why the families were walking on all fours.
Okay.
And
they
called
published
it
a paper, right? Cerebellar hypoplasia, was it?
cerebellar ataxia, mental retardation, and disequilibrium syndrome.
Disequilibrium.
Right.
CAM-RQ, very rare syndrome that derives from an incredible rare mutation which prevents proteins from distributing molecules of fat properly.
Wow. Yeah.
That results in defective nerve cells, brain damage, and loss of balance.
I just thought that, the parents were weird and decided that they were going to walk on all fours, and then the kids just picked up from the parents because they're going to do whatever the parents do. But it turns out that Tacey is 100% correct. They have cerebellar hypoplasia. So the cerebellum is the part of the brain that has the internal map. That's one thing. So when I close my eyes and I point at Dr. Scott, the cerebellum is where the map is. Remember when I had my hypnopompic episode, and I could see all the details in the bedroom that I was in, but the lights were completely out and it was pitch black in there. But in my mind's eye, I could see it. That's all in the cerebellum. The other things that the cerebellum allows you to do is to walk in a straight line. So people with cerebellar ataxia lose the ability to walk in a straight line. They start out walking like drunks, and then eventually lose the ability to walk altogether. So these people had cerebellar hypoplasia, meaning that their cerebellum was malformed genetically, and it was very small. And it says it's a form of non-progressive congenital cerebellar ataxia. So when they say non-progressive, it means you're born with it, and it doesn't get any worse, but it's not going to get any better either. And they will have mild intellectual disabilities. It says this condition affects the balance of 12 of the family's 19 children who walk on all fours as a result. Wow. And they also have a reduced corpus callosum, which is the connection between the right side of the brain and the left side of the brain.
Wow.
Isn't that interesting?
That is. So, yeah, I just assumed when she was going to read it, they had some kind of
hip thing.
Weird, hip or lower back kind of fusion kind of thing, kind of weird vertebra or something.
Because we're not really made to walk on all fours. Our hips are rotated so that we're designed to walk upright. So it is very uncomfortable to walk on all fours, and our ass will stick straight up. Whereas if you have a hip that's rotated slightly forward, then you can walk on all fours like a chimp or something. But they can walk straight up, but it's uncomfortable for them. So it's just the opposite. That's pretty interesting.
Wow, that is good. That's good taste. You kind of wonder if the physiotherapist put them on like balance kind of training and balance exercises and things of that nature. And certainly had to do some strengthening stuff in the spine to stand them up.
If the wiring isn't there, they may not be able to do anything, but it's amazing that they were able to get some of them to walk standing up. So that's pretty cool. Yeah.
Good topic, Taste.
All right. What else you got?
Well, thank you, Scott. I've got some weird and mysterious diseases of the human body. The first one is persistent sexual arousal syndrome.
Oh, wait a minute.
Called PSAS, also called the persistent genital arousal syndrome.
Yeah.
PGAD. Causes people to live perpetually at the brink of an orgasm.
Hope that Hussein.
What was that?
Sorry, that was the YouTube still going, yeah.
The sensations are partially relieved through orgasm, but may return suddenly within a few hours. It can lead to constant Physical pain, stress. Okay, wait. Oh, yeah. And psychological difficulties due to an inability to carry out everyday tasks.
No shit.
So you may suffer from anxiety, depression, distress, frustration, guilt, insomnia, panic attacks.
So what's the treatment for it? Do they give a treatment?
Cognitive behavioral therapy.
That's it?
Wow.
I wonder if they, how about putting them on Prozac?
Like a big SSRI.
Yeah,
give 'em a big-
SSRIs kill your libido anyway. I wonder if that would work. What's the name of this syndrome, Tace?
PSAS or PGAD.
Persistent sexual arousal.
Sexual arousal.
Now, do we need to start
Syndrome,
him on a
yes.
3-minute?
Yes.
No.
No, I mean, no.
No, these aren't questions. This is Tacey's time of topics.
This is important.
So
for God's
maybe
sake.
it's Tacey's decision.
Okay, listen to this.
You got the point.
According to PubMed, some SSRIs may worsen persistent genital arousal disorder. During treatment or withdrawal. Well, knowledge on pharmacologic treatment options for PGAD is not yet evidence-based. Yikes. Wow. Well, that is an interesting turn of events.
It's kind of crazy, isn't it?
Yeah. Most importantly, some drugs such as serotonin reuptake inhibitors, SSRIs, like Prozac, Paxil, Zoloft, may even induce or worsen PGAD during treatment or withdrawal. Okay, we now need an initial spark in order to promote basic research on the origins of PGAD. Yeah, no kidding. If you don't know what's causing it, it's very difficult to treat it. And it says clinicians should provide careful diagnostics and counseling for affected patients. Wow. Drugs that are able to inhibit sexual excitation, such as pregabalin or duloxetine. When duloxetine is a serotonin norepinephrine reuptake inhibitor, also known as Cymbalta, it says may be worth a trial. So very interesting. Pregabalin is also known as Lyrica, which we use that for neuropathic pain. Goodness gracious.
It's crazy, isn't it?
Yeah, you would think that we would have something for that. But anyway.
Maybe it's just not that common.
Yeah, well, that's part of the problem, isn't it? When you've got an orphan rare disease, it's hard for pharmaceutical companies to justify the amount of money it takes. However, I have a friend who's been on the show that has Graves' disease, and he took that Tepezza stuff. It's $800,000. It's an orphan drug. For Graves' ophthalmopathy, so that people with Graves' disease, their eyes will poke out because the tissue behind the eye will enlarge, and so they have a drug for this. It's $800,000 a dose.
Goodness gracious!
And you have to do it 4 times. So $3.2 million. His insurance paid for it.
Oh my gosh! How do they take it? Is it?
It's an IV infusion. Yeah.
Okay, gotcha.
And it didn't
gracious.
work that great.
Oh,
so there
goodness
you go.
sakes!
Yep.
Wow.
So that's, he has that Graves' ophthalmopathy. And he took this drug, Tepezza, which is, decreases the swelling behind the eyes.
So their eyes don't stick out so far.
Their eyes don't sit. That's what happens in Graves' disease. Their eyes kind of poke out.
Right.
And so he had double vision and things like that because your eyes aren't supposed to poke out like that.
No, and they got to get dry too, don't they?
Yeah.
I would think so.
So there's all kinds of problems with it. And it's an orphan drug. It was $800,000 per dose. And he had to take it 4 times. So it's $3.2 million.
Holy smokes.
And on top of that, it didn't really even work that great. But, thankfully for his insurance paid for it. But that is one strategy that a pharmaceutical company can adopt if they've got an orphan drug that only 10 people are going to, or 100 people are going to take this year. Just charge $3 million for it.
Exactly.
That's that old saw. You price something at $1 million, you only have to sell one of them. But
Exactly.
Anyway.
Jeez,
All right.
That's crazy, dog.
Yeah. So that's one of the problems is this is extremely rare and nobody is really doing a lot of research on it. So what this will be is someone will try something and have a great result, and they'll publish it as a case study. Okay. Then other people will try it. If it really works, then it'll become common.
Gotcha.
But sometimes, but it's all off the shelf drugs. Mm-hmm. That's how this will be solved, if it can be solved. All right, what else you got, Tace?
Walking corpse syndrome.
Whoa.
It's called Cotard syndrome. It's a
Cotard syndrome. Yes.
Cotard syndrome, a neuropsychiatric disorder related to depression.
Scary.
This syndrome makes people
ghost.
believe that they are dead or missing their soul, organs, blood, or specific body parts. This syndrome is usually
my spleen is gone.
a symptom of another psychiatric condition rather than a disease of its own. Symptoms include attempts to self-harm, becoming speechless, delusions of immortality, delusions that one is dying, dead, or no longer exists, insensitivity to pain, patient stops speaking, refusal to eat, severe depression or sadness, voices telling the patient that he or she is dead or dying.
Oh, my goodness. I like the idea that they think that they don't exist, so they peer in people's windows. And you cannot see me, like kids do when they cover their heads and because they can't see you, you can't see them.
Yeah.
So is there a treatment for that?
Symptoms are usually managed through medications like antidepressants, antipsychotics, anti-anxiety drugs, and therapy like cognitive behavioral therapy.
Yeah, there's a little bit of a pattern there, isn't there?
ECT,
cognitive behavioral therapy is the bomb.
Very important.
ECT is also used as a last resort.
Okay.
Now, there are people who have strokes who have what we call neglect of one side of their body. And let's say they have a left brain. Well, let's use a right brain stroke. It'll work a little bit better because a severe left brain stroke very often will affect speech. So if you have a right brain stroke, that person will have left body weakness, and they may always look to the right and never look to the left. And then if you pick up their arm, they'll say it's someone else's. They feel it's disconnected from their body. Yeah. And but that's different than this. This is interesting. Right here for Cotard syndrome, combination of medication and talk therapy like cognitive behavioral therapy. Very good.
Very good, Tace.
Give thyself a bell.
Suck it.
Damn it.
All right.
Okay, let's do one more, and then I'll save the rest of these for next time.
Okay.
Foreign accent syndrome. Now, we have a friend who has this after she has several glasses of wine.
Right. Let's just say her name, I don't know, is Susie. And when she gets really wasted, they call her foreign language Susie. But it's because
what's her accent? What does she speak? French or
that like that?
Oh Jesus!
Yeah.
So it's not French or
no,
British.
It's just drunk accent.
Is it Australian, mate?
It's hilarious.
That would be kind of funny.
So
this is something slightly different than that.
It stems from a damage in the part of the brain associated with speech. This happens when a person suddenly wakes up speaking in a different accent. It is commonly caused by stroke, trauma, tumors, and or other neurological conditions. The most common treatment would be speech therapy to help a person bring back their normal speaking ways.
Which you can do. You can teach somebody an accent. Let's see if we can find an example of foreign accent
That is so bizarre, isn't it?
And the thing is, the myth is they wake up speaking a language that they didn't know before. That is bullshit. That's not happened. A stroke can't imbue your brain with circuits that were never there before. It can only take away circuits. So, I think we played this Texas mom that spoke with a foreign accent before. Let me see. Let's try this one. This lady, here we go.
It asked, where are you from? Because of my accent.
It says Judy has foreign accent syndrome. Oh, see, this is
just music.
Yeah,
That's
it's
nice.
just music. It's
Nice
just showing her
and pleasant.
draw. It's like she just didn't have a problem with drawing foreign things. Let's see. Let's try this one.
Thumbs up.
6 months ago, jaw surgery to fix an overbite. Changed Lisa's speech too.
I thought she was playing around with me. I thought she was joking with me, but then she showed me that like the doctor had told her she was diagnosed with foreign accent syndrome, and she searched it, and then I was like, oh Lord.
Houston Methodist Sugarland Hospital.
Okay, let's let her speak.
Kitten. They think I'm talking about a baby cat, and I'm not. I'm saying I'm just kidding, but it's kitten.
Okay, interesting. Well, anyway, all right. We might get a strike because that was CBS News, but it's fine. I'll just mute it and say censored by CBS News, like we did when Philip Glass censored an example of circular breathing that I posted. Anyway, you got anything else, Tace?
No,
All right.
do, but I'm going to save it.
Okay,
because
Scott,
it's
you
been
got
too
anything?
long.
Nope.
There's some stuff from the fluid family, if you want to answer one of those.
Let's see if we can find one of those.
Lovett had one about...
Oh, that's right at the very beginning, didn't she?
Oh, wait, let me get my timer out.
Okay.
Well.
Okay, well, what she asked was repetitive sounds annoy her. And this is a thing, and this is from Lovett, her name is also Patty. And this is an actual condition. It's called misophonia. And it's a disorder that causes people to have strong reactions to sounds and particularly repetitive noises. The miso soup is Greek for hatred, and then phonia is sound, so hatred of sound. And they may experience mild to severe reactions like anxiety, disgust, urge to flee. Now, there are some really serious cases where clock ticking or windshield wipers can anger and disgust people to the point where they get a fight or flight type response. Their adrenaline starts going and they may start screaming or, will you stop chewing?
Yep.
So, anyway, there you go.
That's no good. Hey, and Darth's got one.
Yep. What you got?
Darth's got one wanting to know if raw honey really does help with allergies.
If who?
Raw honey.
Oh.
I thought you said raw honey.
Oh, I apologize.
I thought you said rawhide.
Rawhide. Ooh, that reminds me of a song. Anyway.
It was a TV show.
Yes. Well, it's also in Blues Brothers, when they're doing the song Rawhide.
Okay, which was the theme song of the TV show, wasn't it? I think
probably
so.
so,
Anyway,
yeah. Probably. Anyway, but no, he was asking if raw, local raw honey,
right?
Not rawhide, local raw honey does actually have a benefit.
So I used to believe
allergies,
this.
Yes.
So if you had, say, ragweed or something like that if the bees got honey or nectar from the leaf or from the flowers,
right.
that would give you sort of a sensitization if you ate the honey, and you would form blocking antibodies just as if you had allergy shots. And it turns out that it's bullshit because you usually are not, number one, they're picking up nectar. They do pick up some pollen, but that doesn't really end up in the honey so much. That they, that's
filtered out a little
that's
bit.
the trick that the flowers use. They offer the bees nectar so that the pollen will go from one flower to another and fertilize them. But they usually pick up pollen from really brightly colored flowers, and those rarely cause allergies. And then if you eat unprocessed honey, it can cause serious reactions, including hives and stuff if you're allergic to what's in it. And on top of that, it's better to just have processed honey, in my opinion, although the people who raise bees may disagree. Now, there have been studies that show that daily honey eating, in addition to taking allergy medicine, is associated with less allergy symptoms. But eating locally collected honey had no effect on the allergy symptoms of those versus those that didn't. So it's if you have severe allergies, they recommend that you don't eat honey at all. Even trace levels of allergens can cause major reactions. So you got to know, you got to know what you're eating and what you're allergic to. I mean, you can try it, but if it makes you worse, you got to stop.
Well, I think as far as else, but there's some medical uses for honey.
Oh, absolutely.
Being antibacterial, antimicrobial, but not so much and anti-inflammatory, but not so
they
much.
use it in wound care,
right? But not so much for the taking it orally and helping you with your allergies. But it
If
can
you
be
have-
used for a lot of other things, like nasal sprays with honey in it
Yes.
to block those pollens. Yeah.
Correct. Okay.
Anti-inflammatory, yes.
If you have, okay, you can get a bell.
Yes.
Jeez.
Yes.
All right.
Sucker.
If you have a sore throat, there's some data that says that it may help, particularly if the sore throat's caused by postnasal drip. It's just wearing away the mucous membrane back there. Do not give honey to children under a year old. There's some raw, unfiltered bacteria in there, including botulism, that kids can get from raw, unfiltered honey because their immune system is not yet ready to handle that. So, okay.
Bell.
Okay, got it. That was done. All right, next. You got another one from in there?
I don't think.
Okay. All right. Well, let's do some phone calls then.
Number one thing, don't take advice from some asshole on the radio.
All right, I will not.
Boy, Dr. Steve.
Good morning.
Me and my old lady, I've been getting...
You talking about your grandmother?
That's such a sweet way to refer to your wife.
It is, isn't it?
Well, I'm an old lady. I tell you that. Well, okay. Anyway, all right. Sorry.
I've been getting it on.
Ooh.
Like, a lot since we've been locked up together. We wait until the children are asleep, of course.
Of course.
And I just wanted to let you guys know that I've been shooting like I was 22 again. Like, I
Okay.
pull it out, and it's just, she has to cover her face. I'm literally shooting 2 feet. It's freaking amazing.
Get your hand off my penis!
So I'm edging like I'm Jim Norton over here, and then exploding like freaking Peter North. I didn't have a question, just wanted to let you know.
You just wanted to
nice.
brag.
That is
Yes.
all.
Well, I think that was a 2020 question, too.
Yes,
They said they were
I
locked
believe
up
so.
together.
COVID, yeah.
And, yeah, good. Well,
He probably has.
all right. He's shooting ropes, so
Congratulations.
good for him.
Eat more honey.
Yeah, he just called to brag. There's nothing wrong with that. You can call to brag.
Mm-hmm.
All right, let's see here.
Dr. Steve, I don't exactly have a question, more so a way to...
Okay, so, we've only been doing this show for 20-some years. You ask questions, we answer them, but it's okay. You can call with anything you want. It's free country.
help you out a little bit, perhaps. So
Okay, thanks, man.
we say that
I need help.
you kind of kick yourself when somebody asks a question and you say, that's a great question,
Well, okay, yes, correct.
because, hey, when other people say that, but yet you like to say that all the time. So I figured maybe instead of saying, that's an excellent question, you could just kind of change it up and say something like, oh, I like that question, or I really love that question, or that's an exciting question, or I'm glad you asked that question.
Okay, I get it. I'm glad you called. I really enjoy your statement and your instructions to me. Thank you. I really appreciate this statement that he's making.
Or, I can't wait to answer this question. Or,
I can't wait to try this out when we actually get a question.
or let's see, hell of a question, et cetera, et cetera, et cetera.
like
Maybe
that
that'll
one.
kind of
Yeah, that's a hell of a
That's
damn
a hell of a question,
damn
brother.
idea.
That's a hell of a
get
question.
you out of that little internal conflict that you have.
Thank you,
when
sir.
somebody calls in
Now
and actually
I get in ruts where if you look at the Eclipse video
That's
that we
hilarious.
did in Dallas where Dave burned his eyes out, spoiler alert, that's me yelling, amazing. I think I say it 3 times in the 1-minute video. So I've got to learn to sort of vary things up, change things up a little bit.
He does ask a great question. Okay, keep it up, man. Love the show. See you.
Thanks, buddy. I do appreciate it. It's a good idea. I need to do better. All right. Let's see here.
Hey, Dr. Steve, Dr. Scott.
Hey.
You guys are doing a great job. I really enjoyed the speeded up comments.
Thank you, sir.
So do
I
we.
still think for Casey to enjoy it, you need to get like one of those bells like they used in and around a boxing where she can really.
Okay, what I ought to do is
I agree.
I'll give you a stream deck that has a single button on it, and it's got the bell, and you can do it for the beginning, and then I have 2 buttons. You can do the boxing bell for the beginning of the 3 minutes, and then I'll have you a buzzer for the. And actually, you can set a timer on these things on the stream deck. It's cool. I'll get you one. We'll see how that works. Okay.
Her part. So anyway, I'm going to go out on a high note.
Okay.
Donate my body to medical science, local university.
Yes, sir.
Now, when I do that, do they go in and see what organs are good for donation? Or
No, this is a different thing, but go ahead.
Or do they just send the body on over to their morgue awaiting the students? I was unaware exactly how that worked.
It depends on what you're signing up for. So,
are we beginning the 3 minutes now?
Sure. Yes, please.
Okay.
You ready? Can I start now?
3,
yes,
2,
now.
Okay.
You
Go.
may.
Okay. So it depends on what you're signing up for. There are places like Restore Life USA where you sign up for for body donation, and they specifically say we're going to use body parts for medical research, which means if they need cartilage from a knee, they're going to remove the cartilage from your knee. If they need pancreas cells, they'll remove pancreas cells, and then they will cremate you and give you back within 30 days. If you sign up to go to a medical school, this is not organ donation. What this is body donation, and they're going to do pretty much whatever they want to. Now, you can ask them, what am I signing up for? I mean, you should do that. A lot of times they're sticking you in a vat of formaldehyde, and then they take you out and you are assigned to a group of 2 to 4 medical students who will then learn anatomy using your body. When I did mine, my body had a stomach full of pills, and he had obviously killed himself. That was not what was on his death certificate.
Oh, my goodness.
So I went to my professor and I said, should we let somebody know? And he said, hell no. Some little old lady already got her, her insurance payment for this guy dying from a myocardial infarction, which was what was on his death certificate, and you're going to screw it all up. So just keep your mouth shut. It was 2 years ago, so we just let it go. But anyway, that was wild.
That is crazy.
Yeah, just full of pills. Of pills.
Goodness sakes.
Now they could have been, coated aspirin or something that just kind of blew up in his stomach. Maybe he was having an MI, and he just kept taking more and more aspirin because he had dementia or whatever. But whatever, he had a stomach full of pills, and we just kept our mouth shut. All right. So ask, how'd we do, Tace?
1 minute, 1 second.
Okay, well, Scott, you got something you want to add about it? About donating, your body to science?
Well, I think there's a bunch of different ways, and I think that it's certainly helpful to all of us. Like we've got the Tennessee Body Farm where they put.
Yeah, you can do that. Just throw you on the ground and see what happens to you.
I personally think there are a lot of better options than just being chunked in the cold ground, as John Prine says. Chop me up and pass me around.
Yeah, I like the idea of making ink.
Yeah.
Compressing it into a diamond.
Yes.
Shaking like a diamond.
Or a tattoo.
So anyway.
Possibly, yeah.
Very good.
Cool, man.
All right, let's do
it. That was a good question.
It was very good.
Dr. Steve, if you had unlimited funds for a clinical study or trial, what area of health or science would you focus on? In other words, what could today's society benefit from the most? Curious about your opinion.
Oh boy, that's a tough one. There's the serious answer, which is, the 2 frontiers of science, or medical science right now, are the neurologic system and the immune system.
Right.
And people go, well, what about cancer? Well, that is an immune system problem. That's a problem of surveillance of the immune system, where the tumor is allowed to grow without the immune system recognizing it as foreign and not killing it.
Right.
So that's one. And then the nervous system, we don't know how it works. So I would probably, if I had unlimited funds, because there's lots of funds being put toward cancer right now, I would put it toward understanding consciousness, because when we understand it finally, then we can fix it when it doesn't work right. Just dumping loads of serotonin into a depressed person's brain, we've talked about this multiple times, isn't cutting it.
Yeah.
So,
and dementias and Alzheimer's.
Yeah.
And, Huntington's.
When the brain doesn't work right, we don't know how to fix it.
Spinal cord injuries.
Yeah.
That whole neurological thing from the.
So I would invest
brain,
on fixing the neurologic system and understanding consciousness.
Because don't you think the cancer research, as far as immunology, they're making some progress.
They know what the problem is.
They're getting there.
It's just a matter of
figuring out
how to do it. Right now, we still have no clue what the fuck consciousness is.
No. And I'm pretty sure we won't.
Well, maybe we won't. It might be like Gödel's incompleteness theorem, that it's something that a conscious brain can't understand consciousness, but we ought to be able to understand the mechanism of it. So that's that. And then the silly answer is, I would just do research on, how fast does water drip out of a pipette, and then take the unlimited funds and go on a cruise for the rest of my life. All right? I would abscond with the money.
Have a desert island or something.
All right, you ready for another one, Tace?
Yep.
Here we go.
58 seconds left.
Cool.
Hey, Dr. Steve. This is Jeff from Las Vegas.
Hey, Jeff.
Just calling.
Hey, Jeff. I'm going to be in Las Vegas May 31st to June 2nd, observing Hackamania.
I figured you're going down to see Dead and Company.
Oh, are they going to be there?
Dead and Co. are there, too. Yeah, you went to see In the Spear.
Really?
Yeah, you want to check that out for real.
Well, I will do that.
Oh, my God. That'd be fun.
Yeah.
So what are you going, Hackamania?
Yeah, Hackamania with El Horrible and the WATP crew. So El Horrible and I are going to try to do a poker tournament while we're there.
Okay.
And if we have time, I don't have a whole lot of time. I mean, the part of the main event is on Saturday night, but I got to catch a plane at 12:40 a.m. Sunday morning to get home at a decent time on Tuesday. I mean, on Sunday. So.
The red eye home.
Yeah.
Oh, that's gonna suck.
I like doing that. I just sleep. I sleep anyway.
So rough.
I have no trouble sleeping on a plane.
I can't.
None.
Not even close.
Really?
Nope.
As soon as God, dude, when I get this doesn't count for the 3 minutes.
Well, that's not for you to say.
Okay, let me answer this.
I'm curious about something a doctor told me about.
Oh, yeah, he hadn't even asked his question yet, so the timer hasn't started yet.
We're already answering it.
Anyway, as soon as the plane, the engines start up, I fall asleep, and I have multiple times woken up thinking, God, are we there yet? We haven't even taken off yet.
Oh, my gosh.
So anyway, all right.
How funny.
Very good.
In regards to white blood cell count.
Okay.
I'm 34. I underwent chemotherapy about 10 years ago for testicular cancer, and it absolutely crushed my white blood cell count. And I mentioned it when reviewing the blood panel I just did. My white blood cell count was pretty low. I can't remember what the metric was, but it was 3.15 something. And she had mentioned that there's basically the white blood cell equivalent of EPO, and I might want to look into that the next time I see my oncologist.
Correct.
So, I don't know, I was just going to see what you thought about that. Love the show.
Hey, thanks. So, back in the day, when we gave certain types of chemotherapy, 50% of people would end up in the hospital with a thing called neutropenic fever. And what that means is their white blood cell count would drop so low that the body said, the only defense we have right now is to raise the temperature.
Huh.
And people would end up in the hospital in isolation until their white blood cell count came back up, and we'd have to pump them up with antibiotics just prophylactically to make sure that they didn't get, some bacterial infection. Now we have this stuff called, there's Neulasta and Neupogen, those are the brand names, and they are white blood cell colony factor stimulators. So when you give those right after you give the chemotherapy, it boosts the patient's white blood cell count. And now, instead of 50%, we're down to like 1%. That's huge.
That's unbelievable.
To go from half your patients down to 1 in 100 ending up in the hospital with neutropenic fever. Now, the problem with the white blood cell count colony factor is when it forces all these immature white blood cells into the bloodstream, it causes bone pain. And so sometimes we have to give those patients pain medication. Okay. But the cool thing is, if you take loratadine, here it is again. Isn't that interesting? Loratadine being a non-drowsy antihistamine, also sold as Claritin. If you take it on the day of your chemo and keep taking it daily for the 3 days afterward, then when that white blood cell count colony factor is kicking in, a lot of patients won't have any pain at all.
Wow.
And do you remember what the other thing loratadine is good for?
No.
Oh, that's fine. Tacey, do you
remember?
Allergies.
Besides allergies, yes, of course.
No, I don't.
Was erectile dysfunction caused by SSRIs or any sort of sexual dysfunction like delayed ejaculation, stuff like that, caused by antidepressants.
Wow,
and it doesn't work in everybody, but there's a significant subfraction of people that if they'll take those drugs 30 minutes before intercourse, then they won't have as much effect from their depression medication.
Wow.
That's something.
Yeah, it is. It's incredible, really.
All right.
Oh.
So there you go. So,
Good
yes,
stuff.
your oncologist should already be using these drugs. And if you had one episode of low white blood cell count, they'll start using them from then on.
Right on.
You used to have to come back the next day for a shot. Now they got a patch that they can put on you.
Right.
Okay?
Yeah, it's come a long way, hasn't it?
Yep.
Golly.
All right.
9 seconds left.
It's close.
Hey, Dr. Steve, it's Dr. W here, another dentist calling.
Hey, Dr. W.
I just thought I'd let you know that Dr. H there guy, he's kind of talking out of his ass. There's been no change in the prevalence of wisdom teeth or any other teeth or missing therereof in any of the literature anyway. There's no evolutionary pressure on the species.
Of course. I think this is from several months ago, but I can't. Well, let him finish and then we'll talk.
Not have these wisdom teeth. But yeah, otherwise everything else seems correct. Anyway, love the show. Have a good one.
Hey, thanks, buddy. So the way that humans or any other species evolves is that there's some environmental pressure.
Okay.
So if you are some, mammal, and in your area, all of the ground, the food on the ground is being eaten up by deer and antelope and stuff, you may start to select your DNA for offspring that have longer necks.
Okay.
That can reach higher where the deer and the gazelles and stuff can't reach because they're eating grass or whatever. And then, after a few million years, you end up with a giraffe.
Okay.
And but there was an environmental pressure for that giraffe, proto-giraffes that had longer necks, their DNA was more preferentially passed to the next generation. There's no... Unless women started going, ew, you have too many wisdom teeth, I'm not going to have children with you, then there's no evolutionary pressure for us to lose wisdom teeth. It's crazy. Just like if you take rats and you keep chopping their tails off, they're still going to be born with tails. That's not an evolutionary pressure. You're just doing something to them. Now, there is a thing called epigenetics that may have some effect. That's where not just the DNA, but these proteins that decide which DNA fragments to turn on and turn off, that could be affected by things like chopping a tail off, but so far that really hasn't shown to do anything. So you would have to preferentially mate rats with smaller tails, shorter tails, to get a subspecies or a strain of rat that had short tails.
Okay.
All right? There you go. So thank you, Dr. Was it Dr. W? Is that what he said his name was?
Dr. W, I believe it was, yes. Thank you, sir.
Hey, Dr. Steve, it's Dr. W here.
Yeah, Dr. W.
Cool.
Thank you, sir. We always like having dentists on call because that's one thing they don't teach us anything about in medical school. Nothing about dental health.
We need a dentist in here sometime to talk about the importance of
We had one. Well, okay, different show. We had an oral surgeon in here talking about implants. That's why I have an implant.
Okay,
I have 2 implants.
Gotcha.
Except he kind of lied. He said, well, you don't have to implant every individual tooth. You can just put in 2 or 3 posts and then you put the teeth on there. And then when I go in there and it's like, oh no, we're going to charge you for all the individual teeth that we're going to put in.
Lovely.
I had too much fluoride when I was a
much?
kid. Yeah, you can have too much.
Oh, wow, okay.
And what it did, it made my back teeth brittle, so they were breaking.
Oh, gotcha.
And it was just, I would break
Bell.
the farthest one, then the newest one,
Uh-oh.
and then the next one.
Damn it.
Anyway, so now I have implants. All right, here we go.
Hey, Dr. Steve. This is Mike in Florida.
Hey,
Fuck
Mike.
PA John. Long-time listener. Love the show.
Wow, that
He must be a long-time listener.
That goes way back. Fuck PA John. God, he used to hate that too. He was like, "Why did they say that?" And it's like, John, it's a goof. It's like when they would call Howard Stern and say, "Fuck," F Jackie. It was just funny.
Florida. Fuck PA John. Long-time listener. Love the show.
Thanks,
Got a
buddy.
question for you.
Yes.
I have a pain on both my legs, at the top of the leg where my leg meets my butt cheek, and it'll just come and it'll hurt like the son of a bitch, and it'll make my legs feel very weak. So did I do something to my hamstrings, or just what's going on there, sir?
What do you think, Dr. Scott?
Well,
I think we answered a very similar question.
That's where his
last week.
hamstring attachments are, but it sounds like a little sciatica, kind of piriformis. If it's right where at the bottom of his glutes, where his hamstrings attach, sounds a little. If he's getting some weakness, maybe some sciatica.
Okay, so if it's piriformis, tell him what he could do about it and what the piriformis is.
Real quick, piriformis muscle is a big fat muscle deep underneath your big gluteal muscles, and in a percentage of people, the sciatic nerve actually goes through the middle of the muscle.
Mm-hmm.
Some people actually goes underneath it. Most of it loops over, so it's not as much of an issue. But sometimes you can have a muscle piriformis spasm that'll give you the exact same signs and symptoms of a sciatica coming from the spine, like a discogenic sciatica, we'd call it. So what you can do if it's a piriformis, here's a good way to check it out. If you can just sit and cross one ankle across your other knee while you're sitting up and lean forward. And if that kind of stretches it or elicits some sort of pain, then that's probably what it is.
Now, isn't that one of the stretches that they tell you to do as you get on the ground?
Yep.
And
Yeah. We call it in yoga, it's called the pigeon pose, and it's a really gentle. But the key to it, Dr. Steve, the key to it is 20% of max stretch for 2 minutes. In other words, just
tell them how to do it again.
Gently. It's a pigeon pose. So what you actually do, if you're sitting in a chair, both legs kind of 90 degrees, just take one ankle and cross it over the opposing knee. So if it's my right leg that hurts, I'm going to take my right ankle.
Right, so you're gonna cross your legs like a man,
like a real man. That's right. And then I'm gonna sit up real nice and tall and slightly lean forward. And if you can start to feel that kind of pain recreated going down your back of your legs, there's a good chance it's a piriformis. And it's but the key is again, 20% stretch, very gentle. Don't hurt yourself.
Okay. That's always the thing is don't hurt yourself. You got anything else to add to that?
No, I'm sorry. I was just going to say you can look on YouTube and check out pigeon pose, yoga, pigeon pose.
Or just piriformis stretch.
Just piriformis stretch, yep. The key is gentle, though.
There's one I see that they're doing where they do it with the person laying on their back.
Yep.
And they're taking that, but it's the same thing.
It's the same thing.
You take the ankle, put it over the opposite knee, and then pull the knee up.
Yep. Damn,
okay.
Timer, yes.
I know. Tasty's, God, she's
a timer taskmaster.
I love it.
Well, particularly when we're actually trying to help somebody, and then Tasty's like, "Oh no,
timer,
just stop talking." Okay, here we go.
Hi, Dr. Steve. It's Artie from Pennsylvania. I have this pressure beneath my eyes and the bridge of my nose, and it's been bothering me for, about a year. My eye doctor doesn't find any problems with my eyes or my vision. He said I should just, use some dry eye drops. I've been doing that. It really hasn't helped. I'm wondering what this could be. Could it be from squinting? Could it be from vaping, THC? I'm really not sure. I was wondering if you've had any experience with this.
Let me hear
Thanks,
the very
Dr.
beginning of that.
That's what I'm saying. One more time.
Pennsylvania. I have this pressure beneath my eyes and the bridge of my nose.
Okay.
And it's been bothering me.
Okay, so it's pressure, not dry eyes. So,
some
and he
other
says he
ideas.
went to his eye doctor. I wonder, assuming it was an optometrist. I would go on this one, and no flies on the optometrists out there. I had my optometrist, one that figured out something crucial on my eyes. So I'm a fan of optometrists, but when they can't figure it out and you have pressure behind your eyes and they're giving you eye drops and it doesn't help, go to an ophthalmologist. They're going to have to look at a couple of things. They're going to test the actual pressure in your eye, make sure you don't have glaucoma.
Yes.
They're also going to test your eye to see if it is protruding, because perhaps you may have a thyroid condition that's causing protrusion of the eyeball. And at the very least, they'll have something better to tell you than just take eye drops. Now, go ahead.
Well, I was just saying, what about maybe just some sinus allergy medicine just in case it's a sinus pressure?
Yeah.
Well, possibly. Yeah, I mean, until he gets to the...
Sure, I have no problem with that. However, if he has glaucoma, he may not want to take an anticholinergic medication.
Right.
But the vaping of THC there are anticholinergic effects. We all who've listened to this show long enough know those are fast heart rate, dry mouth, changes in the pupils, stuff like that. And that could be it. So, but how would you know? Just stop
Just
it
don't
for
do it for a day or two. Yeah.
Well, I was going to say 2 weeks. Give it 2 weeks and get a neti pot or a navage and try Dr. Scott and Tacey's idea that it's just actually sinus pressure.
A little sinus rinse will work too,
and then go from there.
Before I had my deviated septum surgery, I had pressure behind my eyes.
Is that right?
Behind my sinuses, and you could see it in my face.
And that went away after you had your, but you had a concha bullosa too, so which was even crazier.
So I mean, if what you say doesn't work, ear, nose, and throat maybe.
I agree. Now the thing is, you don't want to lose your vision. You can deal with the deviated septum for a little bit. So if it is something like glaucoma or Graves' disease or something like that, you want to get that dealt with quickly. So deal with the scarier thing first, which would be going to the ophthalmologist. If they go, hey, you're fine, then I agree with Tacey, and she and Dr. Scott should get a bell.
Give thyself a bell.
For recommending going to see an ear, nose, and throat doctor.
Damn it.
Okie doke. All right. Very good. Well, appreciate everybody. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Goodbye, everyone.
See ya.